It's taking. Hi guys, my name is Emily Lutz. I have some classes with you guys, so I think you know who I am. And I'm going to talk to you guys a little bit about something you're probably going to run into at some point in your life. We have all, going to Kansas City University, spent a lot of time around a lot of other people in big buildings, and most of us are going to go on to work in probably a very big building or spend a lot of time there. And chances are you're going to be walking through your gym one day or something like that, and all of a sudden you hear someone yelling or a group of people yelling, and you see someone on the floor or clutching their chest, and they, good chances are going to be having a stroke or a heart attack. These are two really common things in today's society. And in fact, I can almost guarantee that's going to happen to you. And I don't want you to not know what to do when this really common things happen. And I want you to be ready. So today I'm going to kind of tell you what the difference between heart attack and stroke are, describe them a lot to you so you know how to tell what's going on and what to do when you run into this situation. So the first one I'm going to talk about is a heart attack. A heart attack is basically when the oxygen flow to the heart gets blocked somehow, and that normally happens in the heart. And really what happens is a piece of the heart dies, and a stroke, on the other hand, affects your brain. So the oxygen flow to the brain is blocked, and cells start to die. These are both really serious, and this information comes from the My Doctor and the American Heart Association website. These are both really serious and can cause really long-term problems, and especially for stroke, it's really important to get the person to the hospital immediately, to act immediately. So I want you to be educated so that when this happens, you feel prepared. It's so important to recognize these when they're happening. So I'm going to start with kind of explaining stroke. Some of the things that you can tell that someone is having a stroke as opposed to a heart attack when you run into the situation is that they're going to have numbness or weakness, probably only on one side of the body, slurred speech, or they're going to have a really hard time communicating with you. They might have impaired vision or seem off balance because it's going to affect some of that stuff in your ear and brain. So very disoriented like that, and they're probably going to have a severe headache. And this is according to the National Institute for Neurological Disorders and Stroke. The first thing you want to do when you identify that someone is having a stroke is point to a specific person and say, you call the ambulance. It actually is really important to point to someone because a lot of times no one will call the ambulance because they think someone else is going to do it. For stroke, all you can do in this situation is wait with the person. If they lose consciousness, if they stop breathing, or their heart stops, only do CPR or use an AED if you're trained. And chances are, if you're not trained, just start yelling for someone with medical training because someone is probably going to be nearby or someone knows someone to call. And you can save the person a lot of damage by doing that. This is what strokes looks like, but the other really common thing you're probably going to run into someday is someone having a heart attack. According to the American Heart Association, some of the really common symptoms are pressure in chest, and this will be constant or wavering, discomfort or pain in other parts of the body, they'll be short of breath, cold sweat, nausea, and be lightheaded. And one thing with heart attack is if you have time to ask them, they probably have been experiencing some of these symptoms in a lot lighter or a lot less severe the past couple days. So you might ask them that before you do anything. Again, the first thing you want to do with a heart attack is call 911, but then you need to find someone who has aspirin, and this is really important that you need to have them chew the aspirin and give them a really big glass of water because aspirin is a blood thinner and it will help do a lot less damage to the heart, and this is a really important step. And then also, something you can do that's going to help heart attack be less severe is once you get them to chew that aspirin and swallow it with a big glass of water, have them lie as still as possible. Essentially, you want their heart rate as low as possible, and that will do a lot to help the heart recover more quickly. These are really important to recognize because you're probably going to run into them someday, the heart attack and stroke. I want you to be confident in your understanding of what they are and what you can do when you hit this situation, because most of you are going to encounter it. Today, I hope I've helped you feel better about this, and so you know what to do when it happens. Thanks, guys.